How to recognize bipolar illness. It's important to know that bipolar illness is largely composed of major depression, and most of the time, about 80% of the sick time of a bipolar person is spent depressed, and only about 10 or 20% of their ill time is spent manic. The depression of bipolar illness is similar to the depression of just plain depression, but the mood disorder of mania is a unique feature. The hallmarks of bipolar illness are cyclical mood swings, either in months or weeks, sometimes days long, and swinging from depression to mania. What is mania? You can tell that someone is manic better than they can. A person who is manic doesn't tend to have insight into their condition. But what to look for is a tremendous increase in energy, goal-directed energy, a shunning of sleep, and staying up all night, getting things done, starting many projects, and perhaps finishing none. Speeding tickets, irritability, sometimes involving verbal or physical fights, overspending of money, and talking loud and talking uninterruptedly, and grandiosity. A person who's manic might feel that they're going to create redo gardens throughout the world. The extremes of mania are similar to the extremes of depression in that they can involve psychosis. That's seeing things or hearing things, which is usually a terrifying paranoid behavior. It is not difficult to reduce a manic person's mania, but the difficulty is to secure their permission to do so, because mania is so enjoyable usually for the manic person. I forgot to mention they often have hypersexuality, flirtiness, chatting up a million strangers on the way to the gas station. Just everything intensified. So the time to touch upon the idea of treatment for a bipolar person is usually during depression. When they're down, they have more insight into the nature of the illness, and they're more willing to take medication. The medications needed for bipolar illness are, first of all, to prevent the mania, using a mood stabilizer, so-called, which includes lithium, Depakote, or what are called atypicals, of which Abilify is one. Suffice it to say that the mania can be reduced in a few days, but the depression can take 4 to 6 weeks to disappear. And the antidepressant medication is the usual treatment for the depressed side of the bipolar illness, and a bipolar person would then take both at the same time, both the mood stabilizer and the antidepressant. There are a number of auxiliary meds in case the first two meds don't do the job, but quite often two meds are enough.